Hi, I'm Paula Tran. I am a third year medical student at Oklahoma State University, and I am presenting Frequency and Severity of Depression Amongst Pregnant Healthcare Workers, an analysis before, during, and after the COVID-19 pandemic. I was lucky enough to work with Rachel Terry, Avery Dutcher, and Dr. Bray and Dr. Hartwell on this project. As we all know, COVID 19 has intensified stressors and worsened mental health outcomes for everyone, including pregnant healthcare workers. Depression in healthcare workers can be influenced by fears for personal safety, higher workloads, and social isolation. Pregnant healthcare workers have reported a higher prevalence of psychological symptoms, which was exacerbated by the pandemic. High emotional stress, especially being a pregnant healthcare worker, can lead to lower productivity, increased medical errors, and decreased empathy, affecting patient care overall. The aim of the study is to identify trends of depression, including frequency, severity, and medication use in pregnant healthcare workers throughout different stages of the pandemic. Data was obtained by the National Health Interview Survey, combining these cycles from 2019 to 2021. The categories of the COVID-19 stages includes pre-pandemic 2019, during was 2020, and then the endemic stage was 2021. Questions that were looked at in the NHIS include: one, have you ever been told by a doctor or a healthcare professional that you've had any type of depression? How often do you feel depressed? Do you take medication for depression? And thinking about the last time that you felt depressed, how depressed did you feel? And so this is looking at the diagnosis of depression, frequency, medication use, and severity of depression. In the results, we found no observable differences between healthcare workers and non-healthcare workers when it came to rates of depression, reported frequency of depression, or symptoms of depression. Although just looking at pregnant healthcare workers, during the pandemic, pregnant healthcare workers are more likely to report ever having depression compared to 2019, which was pre-pandemic. Also during 2021, pregnant healthcare workers were more likely to report a moderate to severe level of depression compared to the pre-pandemic stage. And so what does this mean for pregnant healthcare workers overall? Infants born to women with untreated depression are at risk of prematurity, low birth weight, and intrauterine growth restriction. 20% of postpartum deaths are due to depression or suicide. Pregnant healthcare workers in this scenario should be able to request to be deployed to another work area to lessen the burden, such as phone triages or telescreening, and this would limit fears for personal safety, have less of a workload, and more of a social isolation for pregnant healthcare workers. Interventions that hospital or clinics can introduce include talk therapy, support groups, spiritual practices, and this would help reduce exacerbated depression from the pandemic. So in conclusion, the rates of depression and symptoms between pregnant healthcare workers and non-healthcare workers were similar. But looking at pregnant healthcare workers alone, the reports of frequency and severity were greater during the endemic 2021 stage of the pandemic compared to 2019, the pre-pandemic stage. And these exacerbated rates and severities should be prioritized in order to ensure a positive maternal and fetal outcome, and this could help with pregnant healthcare workers being able to return to the workforce whenever they are ready. Thank you so much for listening in.